So this is the poll. You will find the poll in the first poll in the program. How would you treat PRP? If I don't think we made the poll in the audience. So anyway, I would say that everybody is using the first option, which is the full scatter PRP. But there are other options that we should know about, which is targeted PRP, target peripheral PRP, and anti-VEGF, as well as subthreshold micropulse peripheral PRP. So the standard of care has always been the full scatter pan-retinal photocoagulation since its introduction in 1959 in ophthalmology. And then the DRS 40 years ago proved that there is a 60% risk reduction rate in the progression of PDR. And then the ETDRS involved a similar benefit in severe NPDR. So it's not only PDR, but also severe NPDR. However, this proven efficacy doesn't come without a cost. Significant visual damaging side effects, constriction of the visual field, diminished color and contrast sensitivity, poor night vision, dark adaptation, just to name a few. So nobody would like to see his patient have this peripheral retina for the treatment to safeguard his central vision. So ever since I heard the word English literature, postgraduate I'm talking about, I always thought that, well, I went into medical school just to spare myself the literature, but then it came up on haunting me in the literature. So along came a spider, which is a novel written by Patterson. So various studies in the medical literature published the beneficial effect of anti-VEGF injections to halt the progression, even reverse pathology, with a 2 to 3 stepwise reduction in the diabetic retinopathy severity scale. Just to name, Rise and Ride, Vivid Vista, DRCR, .NET Protocol I, as an unintended outcome, a side effect, a beneficial benign side effect during the treatment of diabetic macular edema. So we were treating diabetic macular edema, and then we find a beneficial effect in the PDR. So DRCR.NET Protocol S, which is different than I, was conducted to validate that presumed beneficial effect using a decisive randomized controlled trial to elicit the effect of intravitreal ranibizumab injection upon the diabetic retinopathy severity scale compared to peripheral full scatter pan-retinal photocoagulation as a primary outcome. So that was the main focus of the study. Also, the Clarity study was conducted for the same purpose with aflibercept, which resulted in granting the FDA approval for Lucentis in the treatment of diabetic retinopathy. If you have this patient, you don't want to go down that road to destroy completely his peripheral retinal field. You would prefer, of course, to keep his retina safeguarded, such as that one. So the idea of treating diabetic retinopathy without diabetic macular edema with intravitreal injection indefinitely is really tempting and beneficial to many, especially the companies I'm talking about. So yet the patient may have their own preservations. I'm sure nobody would like to receive injection every month indefinite just to stabilize his condition. So let's have a deeper look into the pathology. Vascular growth factor expression comes from the ischemic retina, not from the healthy areas. Targeted retinal photocoagulation seems to be logic. If you target these ischemic areas, that makes sense. No further loss of function is expected when you target ischemic with dead retina, because they're not functioning anyway. And the functioning retina is spared. And as a bonus, you have your target achieved once and for all, permanently. So that once you treat the ischemic retina, you don't have VEGF expression anymore, and then you stop the proliferation. But then, many studies showed that it's not effective. So there are, but on the other hand, there are other studies that show maximum efficacy, especially the Japanese, they say it's really effective. So there is controversy in the literature. Now we have a new sheriff in town, the ultra-wide field imaging and ultra-wide field angiography. So you can see that this is the 7 standard fields, and as compared to the ultra-wide field, it shows a horrendous difference here. Now you see this is the very constricted, which is really difficult to perform, by the way, by the optometrist, and as compared to the single click in the Optos machine. And this is the fluorescein angiography. You can see here that this is a completely normal fluorescein angiography study in the central steer pole, whereas if you find here that there is neovascularization related to peripheral ischemia, which is completely missed and out of focus if you consider the 7th of the standard field view. Different nomograms to calculate the ischemic index and delineate the ischemia. You can have a color code, you can have a map like this, you can have staging of the ischemia, or you can even just make a dot by any program. You just put it on the computer and make a dot to delineate the ischemia versus the non-ischemic, the functional retina. This is a patient that has been receiving targeted laser photocoagulation, and as you can see, patient spared his inferior retina almost completely, and he spared also superior to the arcade around the disc. He spared so many areas from receiving laser treatment, and as a result, he has a regression of his proliferative disease. This is another example that shows that you can spare some areas with the treatment. Again, you can see here. So this is the color photo. It shows that you can spare a lot of areas that should have been otherwise treated with the classical full scatter PRP. You spared, for example, areas that should have been ablated by the laser in the classical treatment. This is another example that shows the white field shows us the under-treatment on the other hand. So you have this patient received treatment, still there is ischemia that needs to be further targeted and then in order to achieve the regression of the proliferative disease. So now we have a new game changer. It seems that the treatment of diabetic retinopathy with anti-VEGF injection has the potential to reverse retinal ischemia as noted on ultra-wide field angiography. These findings suggest that the areas of ischemia in ultra-wide field angiography can possess viable, salvageable tissues with the potential to reperfuse. So, no study is yet designed to demonstrate the cause and effect between anti-VEGF injection and reperfusion, only likelihoods. There are no evidence to show this. However, reperfusion of vessels might be one of the reasons that clinical trials have shown reversal of diabetic retinopathy after anti-VEGF therapy. So we're no longer talking about preservation of the remaining peripheral visual field along with preserving central vision. We are now discussing restoration of the lost field along with preserving central vision. So this is a small study that I would like to annotate. It's a smart twist. This patient has been receiving treatment. It's not a diabetic retinopathy. It was a central vein occlusion, which is a similar disease, which has also high VEGF expression. And he used to receive Lucentis, ranibizumab, for a year, monthly injections. And he was fed up and he wanted to have anything just to avoid his repeated injections. So that was his ischemic index, as you can see here, after the injection. And it shows that the central ischemic retina...
Time, can we have conclusion?
Oh, okay. Anyway, he received the treatment according to the previous non-ischemia, but then he showed no decrease in the rate of need for anti-VEGF. It was not until he really went into the areas that regained perfusion again to stop his injection. So that's the comparison. These areas that used to reperfuse actually needed to be ablated in order to stop his injection. So that's the smart twist. The bottom line here is the management of peripheral retinal ischemia is an emerging field of investigation in the era of wide field imaging modalities. It carries the promise of delivering etiology-targeted treatment with maximum preservation of total visual function. Further studies are still required to reach optimal approach for management of diabetic retinopathy and safety.
Thank you. Next, it gives me huge pleasure.